So many of my patients, by the time they get to me, they've been misdiagnosed so much. A therapist has told them they have bipolar, they're borderline, they have ADHD, they have dissociative identity disorder. And none of that is true. It's just that the therapist does not understand how this patient presents after a trauma bond. And let me explain it to you. When you've been in a trauma bond, you've experienced relational trauma, which means you will get the typical trauma set of symptoms called complex post-traumatic stress disorder, or CPTSD. But you'll also get atypical trauma symptoms caused by the cognitive dissonance. So you have a dual set of trauma symptoms that cause dual dysregulation in you. And unless you are really an expert on trauma bonds and have a trauma-informed practice as a therapist, right, it can be really hard to understand it. So please, I'm begging you, if you've left your trauma bonds, and I hope you have, that you really go to a trauma-informed therapist that can treat you appropriately. And on my website, I even have an assessment to test your CPTSD symptoms. And it might take digging around to find the right therapist, but I promise you it's worth it, because recovery is on the other side of this.